Another question I get a lot is, are there other heel pain locations? And what does that mean? Well, the answer is yes, but there's only a few. The back of the heel, where the Achilles tendon comes down the back of the leg, is the most important one because the attachment pain is usually something that involves a spur, a slight tear. There are a few that are from compressing against the back of a shoe, but of course the Achilles tendon is a tough tendon to heal. Usually it's non-weight bearing, wearing a boot, and if it doesn't, there's usually a surgical procedure to reattach it if it's too far gone. So this is the one you really have to worry about. The bottom is the plantar fascial ligament insertion. We call that an enthesitis, even though it is a regular plantar fasciitis, which is the entire ligament, which is a broad band that goes from the ball of the foot down a few slips into the heel. There's a medial and a lateral band over here. That pain itself is controlled with rest and arch supports. There is one release procedure, but it's usually after we've failed. The heel itself, if it's compressed or you jump off a curb, you can have a stress fracture. Those are pretty dangerous too because like a crack in a windshield, you don't want this to break. The heel is kind of like an egg and the inside has that type of honeycomb bone that's in the central portion. And it really doesn't do well, this cancellous bone. Once the outer shell is cracked, it will move in several pieces and we'll need a plate and things of that nature. So that's a real dangerous one. We treat that very aggressive conservative with the boot plus non-weight bearing. Other than that, those are the only three areas of major heel pain. There are other odd things that may need a workup with an MRI, like an anterior cyst. But all in all, it's a pretty easy area to locate the problem. And of course, 9 times out of 10, the treatment is conservative.